Hi, I'm Dr. Doug from Konk Sleep and Konk Slim. Let's address menopause. So menopause as it relates to obstructive sleep apnea is very similar as it relates to cardiovascular disease. In cardiovascular disease, before menopause, it is a predominantly male disease. But once you get about 10 years past menopause, the incidence of cardiovascular disease in men and women is just about the same. You see the exact same thing in obstructive sleep apnea. Prior to menopause, it's predominantly a male disease, 2/3 or 3/4, but 10 years after menopause, it's about the same. The problem is we're using clinical assessments that ignore menopause. The Konk Sleep Digital Clinical Interview asks women if they are experiencing menopause and perimenopause, and that data enters into our adaptive logic questionnaire. And if the answer to that is yes, this may increase the chances that you're an appropriate candidate for either positive airway pressure therapy, which we can provide, or dental appliance therapy, which we can refer you to. It also changes the way in which you would evaluate somebody as to whether or not they're a good candidate for a GLP-1 receptor agonist, such as tirzepatide, also called Zepbound. We don't ask these questions typically to decide whether somebody is a good candidate for Zepbound, but it's an important question because just as an overweight man, including a mildly overweight man, would be a very good candidate for Zepbound to prevent cardiovascular disease, the same goes for a woman. But if we're going to wait for her to develop cardiovascular disease 10 years after menopause, we've lost the opportunity. Konk heads that at the pass.